Hello, welcome to my video presentation. I am Shelley Harris and I will present an evidence-based approach to enhancing the quality of life for patients with cystic fibrosis. The delivery of care through telehealth has some limitations, including difficulties with physical exams and limited access to technology for some patients. Some medical conditions may require physical examination to diagnose and treat properly. Telehealth may not suit these cases. Additionally, telehealth may not be able to provide the same level of detailed assessment as an in-person visit. Although technology has improved healthcare delivery, issues such as missed appointments, limited availability of medical experts in rural areas, and restricted patient care continue to challenge the healthcare system. To address these challenges, healthcare professionals and researchers must collaborate and embrace innovative technology to provide patients convenient access to medical care from anywhere. In this presentation, I will focus on a patient named Caitlin, who has cystic fibrosis, and present a scientifically proven treatment program to improve her health and achieve positive outcomes. By working together, healthcare professionals and researchers can adapt to new technologies and treatments and provide excellent care to patients regardless of their location. Allow me to give you several background details about Caitlin. Caitlin, a girl aged 2, was admitted to Valley City Regional Hospital, VCRH, because of pneumonia. This was her second hospitalization at VCRH in the last 6 months. Caitlin was given a nebulization spray by a respiratory therapist and received a thoracic massage from nurses to keep her stable. She had weak respirations at 32, a chloride perspiration level of approximately 65 milligrams, and a temperature of 101, as per the test findings. The doctor diagnosed her with cystic fibrosis after examining her and determining that she had heavy secretions. Dr. Erica Copeland, a pediatrician, suggested intravenous piperacillin, while Virginia Anderson, Caitlin's caregiver, recommended pancreatic enzyme medication and regular temperature monitoring. Due to Caitlin's fragile state and her parents' split, it was challenging for her mother, Janice, to keep up with her doctor's visits as they lived an hour away from VCRH in McHenry. However, the healthcare team at VCRH was sympathetic to Caitlin's situation and health needs. Virginia and Dr. Copeland contacted Dr. Benjamin, a pediatrician in McHenry, to find a viable treatment solution to enhance Caitlin's health. Despite his expertise in cystic fibrosis, the required therapeutic solutions were absent in Cooperstown. Virginia advised that Dr. Benjamin sign up for VCRH telehealth services to get medicine and details immediately. Dr. Benjamin consented to help Caitlin through VCRH telehealth. The healthcare team regularly communicated through text messages, calls, and Skype to discuss Caitlin's treatment. According to Madeline, a social worker based in McHenry, Caitlin's insurance would pay her medical expenditures. Healthcare specialists taught Caitlin's mom how to give her thoracic therapies in a critical situation and checked her temperature and breathing. Additionally, they advised her ways to schedule appointments through Skype and urged her to maintain updates on Caitlin's development in order for her to get the highest standard of care. Now allow me to lay out how the multidisciplinary team implemented an evidence-based practice approach to assist in developing Caitlin's care roadmap. Caitlin's therapeutic regimen was created by an interdisciplinary group using the Johns Hopkins Nursing Evidence-Based Practice Model. This group used this framework to make educated medical judgments for controlling and treating cystic fibrosis using a solution-focused strategy. The EBP team created a practice question according to the issue description, improved it, and then searched for and evaluated it to generate evidence. From the start, the team practice-based inquiries to help them better comprehend and recognize CF-related concerns. For example, which technique best provides medications while tracking Caitlin's health? To avert significant CF signs, how should Dr. Benjamin collaborate alongside the VCRH clinical team? Which amenities are available in McHenry to help Janice with her health coordination team appointments? Can the Resource Center provide internet access if Janet lacks it at her residence? Will Janice's academic background lower the odds of her child acquiring acute CF? The team assessed if the data justifies an adjustment in practice through synthesis. The subsequent step was to combine data obtained from practice inquiries to guarantee that it had produced an improved response to help Caitlin manage her CF and improve her well-being. Evidence summarization assisted in the study, evaluation, and assessment of evidence practice, as well as the evaluation of evidence requirements, and it proposes the most significant proof to incorporate. The third stage was translating the evidence to enhance Caitlin's health by implementing the most effective treatment regimen. Because there is no cure for cystic fibrosis, Caitlin's treatments comprised nebulizer therapy, chest physiotherapy, pharmaceutical care, and a nutritious diet. The group's collaboration aided in the prevention and management of CF symptoms. Her health stabilized when she was given pancreatic enzymes and a higher calorie meal by her caregiver. Furthermore, incorporating aerosol respiration and chest physiotherapy treatments into her therapy plan enabled her to remove mucus and keep her respiratory tract open, resulting in improved lung function. Furthermore, cleaning her respiratory tract lowered her chances of getting influenza. Janice was instructed how to use Skype by the medical staff, which allowed her to contact Caitlin whenever she confronted challenges or saw anomalies while providing care. Even though Caitlin could not visit the healthcare facility, medical personnel integrated and offered exceptional treatment via Skype and texting. The respiratory specialist used telehealth to help Janice manage Caitlin's CF by providing information. Now I will reflect on any evidence I gathered that I found to be most pertinent and beneficial when deciding on Caitlin's treatment regimen. In my research, the most relevant data I found associated with the application of telehealth in mitigating weight loss during pneumonia. Evidence indicates that providing adequate nutrition to children with pneumonia can help maintain their weight and support their recovery. A systematic review published in Nutrients in 2019 found that nutritional support, such as oral supplements, enteral or parental feeding, was associated with improved clinical outcomes in children with lower respiratory tract infections, including pneumonia. Additionally, Caitlin's condition should be stabilized and her therapy should be coordinated. Thus, the healthcare integration team opted to build a telehealth care platform. Considering her lengthy trip to Valley City Hospital, the telehealth initiative will allow her to prevent emergencies and missed appointments that might endanger her health. Relevant evidence shows that telehealth or the healthcare practice from afar using technology has been a vital aspect of contemporary healthcare industry. At first, telehealth facilitated access to healthcare in remote locations. With the advancement of technology, telehealth became less of a pipe dream, but has become a real option. Telehealth has been proven to provide patients with ease, accessibility, and time saving. Patients can access medical amenities via instant video calls from practically any location via telehealth. In remote areas, individuals could get assistance from telehealth to improve their health and control persistent medical conditions. Lastly, I will identify benefits and provide some solutions to alleviate the problems of interdisciplinary collaboration to care plan. Benefits like eliminating duplicate testing and improving holistic treatments necessitate good communication to compensate for the challenge of collaboration while operating remotely. To minimize evaluation duplication, it is vital to collaborate virtually with an interprofessional team. This method saves energy and time. Professionals can assist consumers with various concerns treated by several physicians, simultaneously improving overall treatment. Collaborating with healthcare professionals from different disciplines can increase efficiency in planning care, as each team member can contribute their unique expertise and skills to patients' care plans. Regardless of these benefits, remote working teams can encounter challenges. Communication can be challenging in remote teams, as team members may be located in different geographical locations and time zones or have different communication preferences. Additionally, remote teams may face technological challenges that can hinder effective communication and collaboration, such as unreliable internet connections or software compatibility issues. To overcome these challenges, teams should develop clear communication protocols that outline expectations for communication, response times, and preferred modes of communication. In addition, remote working teams should adopt a team-based approach to planning care, where each team member contributes their unique expertise and skills to develop a comprehensive care plan that addresses all of the patient's needs. Lastly, the management should encourage team members to respect each other's opinions and perspectives and work collaboratively towards shared goals.